Dr. Teuila Percival is a consultant paediatrician working at Kids First Children's Hospital and is also a senior lecturer and director of Pacific Health at the School of Population Health, University of Auckland. Her clinical work includes general paediatrics and child protection. She's undertaken research looking at Pacific child obesity treatment, traditional Pacific pathways to sexual violence prevention, Pacific children with disabilities, and the development of digital storytelling to promote health in the Pacific. She has an extensive background working in the community in New Zealand and also the Pacific. Dr. Percival is Samoan and is a mother of 3 and a grandmother of 1. Now, I'm also going to introduce our second speaker because then they can actually work out how they wish to make this presentation. So I'll introduce Karanina Sumeo now as well, if that's okay. Now, Karanina is a Principal Pacific Advisor to Child, Youth and Family at the New Zealand Ministry of Social Development. She has an extensive public sector background in education, in health, child protection, and is a social work practitioner. Karanina has been a research consultant on a range of projects in the Pacific, and she's the proud mother of 2 daughters and a son of Samoan, Irish and New Zealand descent. Please join me in welcoming our keynote speakers.
Tēnā koutou, talofalava, talohani, namaste, whakalofalahi atu, malolele, kia orana. Greetings also in the warm spirit of our Aboriginal people of Australia. Thank you for your interest in our talk today. Teuila is going to go first. She will provide a Pacific-wide picture of some of the key issues that concern our children, and then I will come back and talk more specifically about statutory social work in New Zealand. So you can see the title of our talk is Va'ai-whitu. Va'ai-whitu comes from 2 words in the Samoan language. Va'ai is to look, to see, to care. Whitu is stars. And we brought these 2 words together to form Va'ai-whitu, meaning the guardianship of stars. Those stars are our children, our families, and our practitioners. So please welcome Dr. Teuila.
Thank you, Karanina, and I will kick off for our combined presentation. We wanted to talk about, as best we can in the very short amount of time we have, Pacific children all over the place. So the 300,000 odd children in New Zealand, the 150 odd thousand children in Australia, and the 9 million people in the Pacific as well. So how do we do that in such a short time? So I'm just going to touch on some major themes and some things that we are doing really well in the Pacific communities. I want to start with this. This is a vision of health and well-being that was come up with by the combined ministers of health for the Pacific Islands at a meeting a number of years ago, and it still rings very true. And it rings true for New Zealand, Australia, and the wider Pacific. And certainly there's good evidence when we interview Pacific families in New Zealand about their sense of what is health and well-being. They talk about things like spirituality and dignity and nurturing. So this is a really good holistic view of what we think of in terms of health and well-being for our children and for our whole community. What are the things that are big issues for children and their families? And this is a big one, a huge one in the wider Pacific, increasing urbanisation and the stress and the difficulties that that places our families in, included also as an issue for our Australian and New Zealand-based Pacific families. With urbanisation, we get a loss and a changing of our traditional social structures. And tradition can be very protective of our families and children. It can be a double-edged sword, of course, but there's certainly good evidence in New Zealand with 2 longitudinal studies that strong alignment with Pacific values and Pacific traditional beliefs is associated with good educational outcomes in our women and reduced cardiovascular disease outcomes in our women too. So there are some very protective things about our traditional structures that it's important that we don't lose. Environments, wherever our children and our families are living, we need healthy, protected environments. Inequalities, a huge problem within countries and between countries. In New Zealand, we have huge problems with our Pacific children having very high rates of disease and illness, the highest hospitalisation rates of all children in New Zealand. So inequalities are a considerable challenge for us. And this is for Pacific people, this is something which is a huge problem today. So in big countries like New Zealand and Australia and America, we don't often think about the huge problem that climate change has for families. In the Pacific, this is a big issue. This is a picture of the atoll of Funafuti in Tuvalu. This is the end of the atoll, and this is normal high tide. And you can see there how close that ocean is to the land. And when the king tides come in February, this land is covered. So we have countries where people are losing their land and losing their homes. So our little islands, this is big for us, and we want the bigger countries to play their part in doing something about it. Food security in all of its guises is a huge challenge across the Pacific and also New Zealand. So we have Pacific children with problems with obesity because of the food environment and the food framework that they're living in. We have children in the Pacific Islands who have severe malnutrition and kwashiorkor because of a different kind of food environment. So food and the access to healthy food is a big problem for our kids. Health services for children. We are always fighting against being not a priority. Adults are priorities and children aren't. So fighting for children having decent services is an ongoing issue all over the Pacific, and of course it's an issue here in New Zealand as well. And the best way to take care of children is to take care of their mothers. So mothers' health is absolutely critical to our children's well-being, and in the Pacific we have too many women dying in childbirth, and in New Zealand we have too many women who present late in pregnancy without having adequate care. Violence against women and children, huge problem. One of the sort of last areas to be recognised as an issue and to have some sort of resources and attention in the Pacific. But there are some NGOs and some governments that are putting a bit of resource into doing something around violence and gender equity as well. So what are some good things happening? This is Samoa. This is my good friend, Dr. Farah, who's a paediatrician in Samoa. And in 2010, she had the first Samoan Children's Health Conference. And the reason I mention this is it was a different sort of conference. Usually what happens is doctors sit in rooms and we talk to one another, or academics sit in a room and we talk to one another. And what Farah did, which was different, was she invited the community. So she invited the village mayors and the matai, and they were part of that conversation about what it is that we need to be doing for our children in Samoa. So involving communities at the start, at all levels, is really, really important, and I want to acknowledge my colleague in Samoa for the work she's doing. Tonga, this is some midwives and nurses in Tonga. Now these nurses, these nurses in Tongatapu have an antenatal attendance rate of more than 6 contacts for 2/3 of all their pregnant women, which is better than New Zealand. It's a very, very successful nursing system, and they do so well because they know their communities, they care about their women, and no woman falls off a list. So if you don't turn up, they will come and find you. And what about our Pacific providers here in New Zealand? I want to acknowledge the great work that our Pacific providers are doing here in New Zealand. And one of the great things that Pacific providers have done is they've developed multidisciplinary teams in primary health care. So instead of just having the practice nurse and the GP, they have community health workers and they have social workers in their primary health care settings. Very important when an awful lot of our people have basic social things that need to be attended to. This is taken from South Auckland, And what it's showing you is high rates of Pacific children ending up in hospital with various things, but the red line there is trending down. And what it's showing you is a reduction in children, Pacific Island children, ending up in South Auckland's hospital with pneumonia. And this is not happening anywhere else in the country. It's happening in South Auckland because we have excellent nurses, primary health care and outreach immunisation services, which are making sure we've got the best immunisation rates in the country for Pacific Island children. So we immunise our kids against a bug called pneumococcus, and the pneumonia rates come down. This is Inua Ola, which is a health program in West Auckland. And this was a program set up with numerous churches in West Auckland, and again, it began with a conversation with the leaders of these churches about what do you want to do to make your communities healthier. So instead of coming in with, this is what we're going to do, I'm a doctor, I know what's most important and you should do this, it was starting with the community and asking what did they want to do. You're going to be more successful if you work in partnership with communities and not deliver things to them. And this is a picture of Vanuatu. One of the things that is happening and has started to happen really well around the Pacific in the last few years, and it's also happening in New Zealand, is to grow our Pacific Island workforce, grow the Indigenous workforce. The people who can look after our families best are the people who know them best. So in Vanuatu, the front line is run by nurses, nurse practitioners, nurse specialists and nurse anaesthetists, and they're Ni Vanuatu nurses. And the doctor workforce is increasingly becoming Ni Vanuatu as well. This is one of my favourites. Tuvalu is a little wee country. It's got 10,000 people, 9 islands. One of those islands has an airport. The others, you've got to get on a little boat and travel to get to them. And there's one hospital on one island. And what this country does, what the government has recognised, is that women and pregnant women and babies are important, and they've put money into that policy. So they have a policy to ensure that there's a midwife on every single island. Every first-time mother and every at-risk mother, the government will pay for them to come to the island where there's a hospital. They pay for a caregiver or the husband to come with them. And then they give them a daily living allowance to wait so they can give birth in safety at the hospital. It's a small amount, it's 14 Australian dollars a day, but what this shows me is a government who recognises the importance of women and babies. I love this one. I've done a bit of research in child pedestrian injuries, and whenever I go to Samoa, one of the things I see is that there are traffic calming judder bars all over the place. And in the morning when the children go to school, what you will see, any of you who've been to Samoa, is you'll see policemen all over the streets around the schools to make sure that children get to school safely and aren't hit by cars. So for me, this is really important. One of the biggest killers of children once they get into the primary school age group is car-related injuries. So fantastic, and I want to acknowledge that the Samoan police recognise the importance of protecting our children on the roads. Another thing that we're seeing, of course, is increasingly diverse Pacific populations, increasingly young, well-educated and connected young Pacific women and husbands and families. And this is an example of a program designed for that increasingly young, connected demographic. What we found in South Auckland is that 80% of Pacific women have access to a smartphone. And young women are more likely to go to digital devices for health information than to a clinician. So this is a service which has responded to that. So there's a website, this is addressing pregnancy and health in the first year of life. And it's translated into multiple Pacific Island languages. You just click on the flag. And they've also developed an app which can be downloaded for free. you can put in your last menstrual period date, and then what happens is the app will calculate your due date, and it'll tell you the story about where your baby is and how it's growing every week as the weeks go by. And again, it can be translated into multiple languages. And lots of really useful information, like finding you a midwife that's close to you. And breastfeeding, of course, one of the best things we can do for our babies. So lots of positive things that are happening in Pacific communities and within our practitioners and our families. And Karanina and I just wanted to share that. And she's now going to focus in a little bit more depth. Karanina.
So we wanted to give you that wide picture, I guess to show you that Pacific communities are innovative. They take responsibility for their people and for their children. And one of the things that Teuila didn't talk about, but perhaps if you've been to the Pacific, you'll know this, that the majority of land in the Pacific is owned by the indigenous peoples. So those hospitals, the schools, the health centers, all those sort of facilities sits on the lands of the people, not government. So therefore, Pacific people are not only stakeholders and users of services, they are shareholders. And that is quite a significant difference between Pacific people and perhaps the indigenous peoples in contexts such as Aotearoa, such as Australia. And so even though Pacific people come here, there may not be plenty in the hand or in the purse, but there's plenty here and plenty here. The wisdom from the experience of generations of self-empowerment and taking responsibility. So that's why we wanted to show you some of those slides to give you that understanding of Pacific people. The other thing that Pacific people do back home is, aside from giving over the land and access to water and so forth, is they also have a deep respect for professionals, for practitioners. So often in the rural communities, the local villagers, the families take turns taking food to the teachers, the nurses, the doctors. We take care of them because there's a recognition that there is limitations in one's own skill, and there's deep respect for practitioners who come into communities for the skills that they bring, because without that, the aspirations for children, whether it be health, whether it be education, cannot be achieved. So there's like a three-party approach in the way that Pacific people look after their own. And I've put it up here, and it's a form of guardianship. So when we're talking about children, there is the child, the guardianship of the child, guardianship of the family, but also guardianship of professionals and practitioners who come to help us. And we can do this in the Pacific because the people own the land. They instinctively understand the connection between ownership of land and resources and the best interests of children. So in this context, in this Western context, they don't necessarily have that. But like I say, there is vast experience of self-empowerment and responsibility. So in terms of practitioners, I suppose one of the things, there's a list of things that we need to take into account when we're working with Pacific people here. Is that number one, they are experienced stakeholders, shareholders, and guardians in the development and the protection of children. Number two, they are experienced in exercising agency. So we can expect that they will succeed. We can expect that they will come to the party when one of their own has broken and violated sacred relationships we call tapu, in the form of sexual abuse or child abuse or family violence. They have broken those sacred relationships, but the rest of the family will come. We can expect that. We can also expect collective responsibility to be still functioning in our Western context. And even though when we come here, families are scattered, but there's always an active group within that collective that can be called upon. And that active group don't necessarily all live here. Remember, we are migrant settler groups. Some of our significant decision makers and families actually live overseas. And we know as practitioners, we've called on them at times when we're making decisions for families. So we'll go now, we'll just reflect briefly. I'll give you a snapshot of where Pacific children are in New Zealand in statutory social work. So in terms of population, Pacific people make up around 7.4 of New Zealand's population. When you actually look at children and young people, that percentage rises a little bit higher. So if we're looking at 0 to 19, around 11.7% are actually made up of Pacific, so much higher than the actual general population. If we look within the group, in that group of children and young people, we see 49% are multi-ethnic. So for example, 17% of Pacific children from 0 to 4 are actually Pacific Pākehā, or Pacific European for those who don't understand. About 13% are Pacific Māori, Māori being tangata whenua of Aotearoa. So actually, by extension, we can imagine that the households where these children live are actually multi-ethnic. So for my children, grandma is Irish. So whereas my children could be Pacific, but they could also be non-Pacific, depending on your lens and depending on how they're categorized in data. But the point is that when we're working with Pacific families, we have to move to this lens where we have to be multi-ethnic in our approach. It can no longer be a traditional, say, Samoan approach or a Tongan approach or Fijian Indian approach. We must think quite laterally in order to work effectively with the children. The stat there, about 14% of children with an abuse finding were Pacific in 2013. That is not good news, obviously. And so we work with them. And then the children who end up being in state custody, about 8% are Pacific. So that is underrepresentation if we compare it to the percentage of children in the youth population, but it's actually nothing to celebrate. But if we look at the 8%, it says something about the families we're working with, but it also says something about the approach that our practitioners take in making sure that the least number of Pacific children end up in state care. Since October 2010, we saw 80% of Pacific children who obtained what we call in New Zealand a home for life. It's basically a permanent placement with family. The majority of our kids went with family. And that's a good affirmation of our value around belonging, around connections, and around collective responsibility for children. So going forward, SIPS has been working, SIPS as Child and Family has been working on developing a Pacific practice framework to help our practitioners work best or do their best with our Pacific children. And there have been questions about whether that would actually help. People can't see how a cultural framework could contribute to outcomes for children. So let me give you some examples. In the Tongan culture, there is a term called watungia, which is duty. And if you understand in the Tongan culture that the patriarchal, the aunts on the paternal side have naming rights to children. So, for example, we had a young girl who'd been in care for some time. The social worker was non-Tongan, didn't know where to go. We've got this kid who's been in care. We need to find family. So by calling in a cultural consultation, the Tongan staff were able to tell her, if you can find out who named the child, we will be able to find family. And so that tip was enough for our non-Pacific social worker to actually track down who named the child. And through there, we found her father and her paternal family, and it provided an option, a permanent placement for this child. The child wanted to go there. we made sure that she was happy and settled there. But that's how you can connect cultural insight to an outcome. Another example, if we look at youth offending in terms of resistance, we have an example where a family had generational involvement with the department. And through that time, things didn't quite go right all the time, and they became resistant to working with us. We couldn't get through the door. We didn't know much about the family. And so we had a Pacific social worker from that culture. It was a Niuean family. And he read the history and decided, actually, we need a different tactic. We need a Pacific tactic. So he decided to use a process called talanoa. Talanoa is a free narrative engagement, type of engagement. So for 3 visits, he went to see that family. No pen, no paper. He just went to engage with them. He wanted to know them. They wanted to know him, and so forth. And at the end of those 3 visits, he knew so much about the family that when he went to see the young person, it was easy to establish rapport. So from outcomes to actually overcoming little things like resistance. And we know in statutory social work, if you can't get in the door, you can't get very far. So that's another example. And the final example I wanted to give you was one where we've incorporated Pacific notions of restorative justice into our processes. So for example, in the Samoan culture, we have a process called ifonga. Ifonga is when a family of the perpetrator goes and offers a public apology to the victim and the victimized party. As our whānau talked about before, the pain caused by one person actually affects everybody else that's associated with that person. So for example, in an FGC, we had a Samoan family of a boy perform what we call the ifonga. It's not a genuine ifonga, obviously, it's a different context. But the principles of humility, of public humiliation, and taking responsibility for that young boy. So in this FGC, we had opportunity for the victim's family to have their say, and then we gave an opportunity to the boy's family, the Samoan family, to have their say. When it came to the Samoan family, Mum got down on her knees and bowed in front of the victim's family, and so did the boy. That is what we call an ifonga. That process, at that very moment, was what transformed this boy. Up to that point, he really didn't have appreciation of what he had done. But it mattered to him what his mother was doing. So it was a transformational process for him. So this is what I mean in terms of incorporating Pacific principles of restorative justice into the way that we work. We can achieve an outcome. That young person has not reoffended. So that is a positive outcome. So looking ahead, we hope to complete this practice framework. It's taken a lot of effort, and some of our champions are here, some of the practitioners are here. They will talk on Wednesday. And again, I mean, that piece of work has taken a lot of time, but it started from a place of humility. The Pacific practitioners were honored to do this work for child, youth, and family, because humility creates space for learning, and also it starts to rebuild trust. So it's been an exercise in relationship building and trust building within SIPs. Okay, so now I'll leave it there. Like I said, there's the workshop on Wednesday. You're welcome to come to and ask questions. We welcome your challenge. And because the framework has been developed in a way so that non-Pacific can utilize it, can take up the knowledge and utilize it. So we welcome your participation on Wednesday. Okay. Good. Good. Well,